When I decided to run for re-election, one of the top three priorities I identified was increasing our nation's investment in medical research. I know how important that research is for patients and families struggling with many illnesses: cancer, ALS, Alzheimer's, Parkinson's, the list goes on and on. Medical research holds the promise of new cures and treatments that both improve and save lives. Today, sadly, we've been reminded of the necessity and importance of medical research as the coronavirus epidemic has ravaged countries here and abroad. Like so many other pressing public health challenges, if we hope to find a cure or a therapy for COVID-19 or a vaccine to prevent it, we'll need our best researchers and scientists on the case, which means we need the National Institutes of Health and the Center for Disease Control and Prevention on the case. I'm pleased to report some good news. Rejecting dramatic proposed cuts from the Trump White House, Congress has provided the National Institutes of Health with nearly 40% funding increase over the past 5 years, an additional $11 billion. During that time, we've also increased the Center for Disease Control's budget by 15%. But more must be done. We know the toll that the coronavirus pandemic is taking on medical research nationwide. It's closed labs and caused researchers to put much of their work on hold, which is why Senator Jerry Moran, a Republican colleague of mine from Kansas, and I are pushing for Congress to provide an additional $15 billion in NIH funding to support research that's been stalled by the COVID-19 pandemic, as well as coronavirus-related research as well. Thank you for fighting alongside me all these years in support of increases for our nation's medical research agencies, especially the NIH and CDC. We have a lot of work ahead of us. Let's stick together and get it done.